This is a contrast NAN-CT of abdomen and pelvis. The patient has got carcinoma of the left half of transverse colon. This is a nodular lesion here. Although this is a small nodule and it is difficult to characterize such small nodules, especially if it's a single nodule, but the possibility of this being a metastatic lesion is more once we know that the patient is a case of carcinoma. Now please observe that there is circumferential thickening of the left lateral part of transverse colon. The wall is circumferentially thickened, although it's not a very gross thickening, but there is abrupt transition to the normal proximally as well as distally. This is the distal part, normal looking. This is the circumferential thickening of the wall of left lateral part of transverse colon. There is infiltration of adjacent fat. Please observe density of the adjacent fat is slightly increased. Multiple small nodules are present above the lesion, like this one here, most probably metastatic lymph nodes. Although these are sub-centimeter sized, but since they are present along the growth, so their likelihood of being metastatic is more. Now, since this growth has resulted in luminal narrowing, rather severe luminal narrowing, there is dilatation of the proximal part of the transverse colon. It is fecal loaded. So the growth has, this is the hepatic flexure here. This is the descending colon here. So the growth has resulted in narrowing of the lumen of left lateral part of transverse colon and subacute colonic obstruction. But small gut is almost of normal caliber. No signs of small gut obstruction. I trace it down. This is the rectum here from below upwards. This is the sigmoid colon of normal caliber. Sigmoid colon. I trace this upwards. Descending colon. It is of normal caliber. This is the splenic flexure of colon here. This one. Now I scroll it down. This is the growth here at this level. Although the growth is small, but since it is constrictive and it has resulted in narrowing of the transverse colon, so there is significant colonic obstruction.